Hi everyone, this is Mrs. Wan.
Hi everyone, this is Mr. Pawan.
So we are here to thank Dr. Abhishek Soni. So we were really struggling with our kid Adhyant, who was just 4.5 years old and was suffering from a lot of toothache. We did have a bad experience in the earlier dental clinic and he was absolutely traumatized with his incomplete root canal process. So we were really finding some hopes and we were recommended to Dr. Soni. And we did come here and at the very first session he was really supporting enough and he gave us the courage to make this entire journey for his oral correction very successful. He did inform us that it will be done in 3 steps. So we did try with the oral sedation, the gas therapy, and unfortunately we had to go for the GA. As parents, we were really skeptical about it, but he gave us the courage that yes, it is going to be very safe. He solved all our doubts. I actually urged him to make a second visit because my husband stays in Mumbai. So when he came back to Pune, Dr. Soni did meet us in a very short notice, and he also solved every doubt of him as well. And then the final day, he gave us the courage. He gave both the hopes that yes, it's going to be a very successful one, and he really treated Adhyant in a very way any parent would have really treated his son. So we were really happy that we have given him in the safe hands. And now after the big process of the oral correction therapy, we really have a vanilla smile on the kid's face. And thank you so much for it.
Would you want to say anything to parents? Like a lot of parents, they have an anxiety when it comes to undergoing kids for the process of GA, which we totally understand.
Yes.
So is there any piece of advice that you would want to give them?
So basically, the entire process is not at all very risky. But the only thing is like we have to really make our kids prepared for that process, and we have to ensure that whatever the pre-checkups are there, pre-checkups are recommended by the dentist or by the pediatrician, those are well done. We shouldn't skip that. So if all those things are correctly done and if we are really informing the doctors well about the entire thing done correctly, or if any of the medical illnesses if the kid has, then it is not at all a harm for having this age kids to undergo a GA process. It is absolutely safe, and the hospital where Dr. Soni had recommended us, they were very well educated staff about this particular process, and they in fact knew, like we were asked to go at 6:30, so they were really aware that what has to be done. They knew about his medical condition or the anxiety issues. So more than us, they were actually more keen and protective about him. So that itself is a good thing, and GA process is safe if we are following all the instructions given by the pediatric team or the dentist team or whosoever is really involved in that entire process.
How did you prepare him?
So we had not really given him the proper information about it because he had a very traumatic experience in the first session at a different place, and where he was completely awake when the local anesthesia process was going on. So he was very scared to even open his mouth for the next few days for brushing his teeth or even eating for that matter. And he also had lost his confidence in us as parents, because whenever we used to take him out and just say that okay, we are going in a park or something, he always knew that we are taking him to a dentist. And eventually he even started showing us those dentist boards where there were tooth marks like in the light and all those like symbols. So he was trying to show us like okay, that's a dentist. So we understood he was really terrified inside. So we did tell him that we are going to his father's office and we are going to have a short visit over there, and we are going to meet a friend of his, and he's just going to quickly check you. He's going to give you a medicine. You just have to inhale it, drink the medicine, sleep for some while, and come out with the doctor, who's the father's friend, and then we're going to take us home.
Okay.
So that's how we really prepared him, because we didn't have unfortunately that much span to prepare him because of that incomplete process. It was a very hardly 20% root canal done. He was already in pain. The medicine was shading of whatever was applied over there, so those effects were also decreasing. So we didn't get a huge time to prepare him, but nor did we get a huge time to prepare ourselves. So that's the reason we are really thankful to Soni sir that in that short span he really gave us the courage and those positive vibes that it is going to be a successful one. So the entire process when he was there, I had kept my fingers crossed, and then he really saw that. He again, no, you can release your fingers. It's not like a very huge man, but he also gave us a chance to like he does that with all the kids or the mothers, but he really allowed me and my husband to be there till the last minute, and informed the entire staff over there that like this particular child may need the parent for a longer duration, so just allow them inside. So everything of that sort is taken care.
Procedure is well planned, hospital is well planned, and Dr. Soni did a very nice procedure work within short 55 minutes time. All are planned and very safe procedure. We are very happy for all this setup and arrangements.
Thank you so much.
Thank you so much.
Thank you.